In this problem, a researcher wants to compare two treatment options. One of those is listening to soothing music for 20 minutes, and the other is simply sitting quietly in a noise-free environment for 20 minutes. So either way, 20 minutes is going to pass, and a patient is going to be measured at the beginning and the end. The response variable in this case is the diastolic blood pressure, and they're hoping that it will go down. And that's the expectation in this study, is that the diastolic blood pressure will go down when there is music being played. So the question is how to best use the 100 patients that we have available in order to get a statistically valid study that we can then make decisions on. If you go ahead and take those 100 people, you could test every one of them twice. That's one way you could do it. You could test every one of them in two completely separate times, so let's say completely different days, and on one day you would run a test where you take their blood pressure reading, and then they sit in the room for 20 minutes, and then you take the blood pressure again. And on one of the days, those 20 minutes is spent listening to music, and then let's go ahead and copy this, and on another day, this 20 minutes is going to be spent simply being quiet. So on one day here, we're listening to music, and on the other day, it's just silent. And if we did this, we could do this for all 100 people on totally different days, and in order to add some randomness in, you might flip a coin as to which one they're going to do on the first day and which one they're going to do on the second day. So some of your patients would on the first day listen to music, and then on the second day have silence between their tests, and then it would be the opposite for other patients in order to ensure that putting one of them first doesn't affect the results. So again, we're trying to isolate the only variable here as whether you're listening to music or not between these two readings and see which one drops your blood pressure more. If you did this, this would be called a matched pairs design, because it would be one person taking two separate tests and comparing one result to another. So the same person, different times, different treatments, and you're comparing which one works better than the other. Another way you could do this is to block your group. You have 100 patients. You might want to block them, let's say, by their blood pressure. So you take, since there's two treatments, you would make blocks of two. And you would take the two people with the highest blood pressure, and you would put them into a block. And then you do the same thing with the next two highest, and so forth until you used up all 100 people. And you would randomly assign one of them to the music treatment and randomly assign the other to the silence treatment between their readings. And you're assuming that since you're randomly assigning people to one group or the other, and the two people have very similar starting blood pressure, that you should have pretty comparable results. And even if one person might happen to respond better than another, given 50 blocks that are being tested, the randomness should account for that and wipe that out. So two valid designs that you can do is have every person get tested twice, so 100 people tested twice, different days, and then compare their two scores. Or you can have half of your people do the music treatment, the other half of your people do a different treatment, and because you're blocking and using random assignment, you're going to actually get very valid results from that. Second part of this problem looks at the types of errors that can happen. In this problem, it says the null hypothesis is that there's no difference. And if the null is rejected for the alternative, which means that the music treatment is better, the music treatment has a greater decrease in blood pressure. So if the null is rejected, the clinic is going to offer music therapy as a free service. to their patients. So in this case, if you incorrectly reject the null, that's always a type 1, remember? So if you accidentally reject the null, you're going to be offering free music therapy. So type 1 is going to be free music therapy. Now, that might be slightly expensive to give away this free music therapy to patients, and overall, though, I don't know that that's a particularly dangerous or costly thing to give away this free music therapy. So the danger of rejecting the null hypothesis doesn't seem like it's a real big deal. Type 2 error, on the other hand, is not rejecting the null hypothesis when we should have. So a type 2 error would be to say that the music therapy is in fact actually better, but we didn't have enough evidence to prove that. So if we had a type 2 error, then our problem would be not giving people the best therapy, so not giving the best treatment. And if we didn't give the best treatment, well, that could have effects on our patients. So that might not be such a good thing. It seems like in this situation we would be much more willing to take a type 1 error if we can minimize the risk of a type 2 error. Unless, of course, the silence treatment is truly better, that would be a different situation. But in the standard case where we're not sure and we just don't have enough evidence to conclude that the free music therapy is better, we would want to minimize the chance of a type 2 error, and we would be willing to have a higher chance of a type 1 error. So instead of an alpha of 0.05, maybe an alpha of 0.10 or 0.15 is something we could get away with in this situation.